Good morning, grade 5. Today we're going to learn about the basic first aid for common musculoskeletal injuries. Musculoskeletal injuries are injuries that affect body movement and the ability to function in normal day-to-day living. It involves damage to the bones, joints, ligaments, tendons, muscles, and other soft tissues. Here are some first aid for common musculoskeletal injuries. Sprain and strain. Sprain is an overstretching or tearing of the ligaments, which are the bands of tissues that connects two bones together in your joints. On the other hand, strain is an injury to the tendon or tissue that attaches the muscles to the bones. So, as you can see in our picture, this is a sprain. So, this is the ligaments or the overstretched ligaments that attach these two bones. And then here, in strain, so you can see this tissue that attaches the muscles to the bones. So, it is damaged. This is due to certain activities. So, the first aid in sprain and strain is known by the acronym RICE or R-I-C-E. So, let's look for this first aid. First, rest. The sprain should be rested. So, no additional force or weight should be applied on the injured area. And in case of a sprained ankle, walking should be kept to a minimum. So, you should be resting. Next, ice. Ice should be applied immediately to the injured part to reduce swelling and pain. So, it can be applied for 10 to 15 minutes at a time, 3 to 4 times a day during the first 48 hours. Compression. An elastic bandage or wrap should be used to minimize unnecessary movements to the injured part and to provide support. Make sure that compression does not cut off circulation on the limb. And the last one is elevation. Keep the injured part elevated above the heart to help prevent and minimize swelling. So, depending on the gravity, a sprain can take days or months to completely heal. So, over-the-counter pain relievers can help ease the pain. And when it still continues, the patient should see a doctor if it does not improve within 2 to 3 days. Muscle cramps. A muscle cramp is a strong, involuntary, painful contraction of a muscle, usually lasting from a few seconds to several minutes. The first aid for muscle cramps. First, stretch and gently massage the affected muscle. Next, apply an ice pack. This is to help relax the muscle. Take an over-the-counter pain reliever if needed. So, read and follow instructions before you take any medicines. And the last, drink plenty of fluids. So, sports drinks restore electrolytes that can help prevent muscle cramps. These are what example of these are the Gatorade, like that. So, if the cramp is in the leg, you may try to do walking around or jiggling the leg or stretch calf muscles. So, you can do this while sitting or standing. Dislocation. Dislocation or joint dislocation is also called luxation. So, it occurs when two connected bones become separated due to an impact or fall. So, this is the example of dislocated finger. So what is the first aid for dislocation? First, reposition the joint back into place. After that, immobilize the joint by asking the patient to wear a sling, splint, or cast for several weeks. This will restrict movement until the joint has fully healed. Third, prescribe medication to relieve the pain. And lastly, recommend a rehabilitation plan that will slowly restore the joint's strength and range of motion. Fracture. Fracture is a broken bone that commonly results from a strong blow, accident fall, or sports injury. So there are two types of fracture. If the skin is punctured, it is called open or compound fracture. And if the skin is not pierced or punctured, it is called closed or simple fracture. So either way, the important thing is to remember when a fracture is suspected, not to move the victim unless not doing so will expose him or her to further injury. So this is the open or compound fracture. As you can see, the skin is punctured, while in the closed or simple fracture, the skin is not punctured or pierced. So what are the first aid to do if someone has a fracture? First, stop any bleeding. You can use any clean towel or clean piece of cloth and apply pressure to the wound. Next, immobilize the fracture area. Immobilize means not moving. Do not try to realign the bone or push a bone that is sticking out back in. Apply a splint to the area above and below a fractured limb. If the victim has a broken neck or back, help him or her stay as still as possible. Third, apply ice packs to limit swelling and help relieve pain. Do not apply ice directly to the skin. Wrap the ice in a towel, piece of cloth, or some other materials. Last is treat for shock. If the person feels faint or is breathing in short, rapid breaths, help the person get into a comfortable position and advise him or her to keep still. Keep them warm with a blanket or any thick clothing available. And in any case, call for medical help immediately. So these are the first aid for some common musculoskeletal injuries.